Hello, good evening. How are you? How are you day? Welcome again to my page. My name is Frederick Unubohai, especially for those who they watch me for the first time. So today I decide make I come online and make I respond to few questions. I notice say today I did a little bit free. Like, okay, ma come online, make we chat small. So if you get any questions for me, drop your questions in the comment section. I did live on YouTube. I did live on Facebook. I also did live on TikTok. So good evening and how are you? Tell me where you did watch me from. Let's go. In case you did hear me, oh yeah, let's talk quickly. How far? Yes, welcome. Now I get one question which somebody asked me. Somebody asked me, he say, Doctor, which test person go do when person won't marry? So you be man and woman, una they plan to get married. Which test una go do? Okay, this is a good question. And I say make I talk about them quickly. The first important thing we are going to need you to do be say you go need to do your genotype. You go need to know your genotype, you and your partner. However, I no believe say now when una wan marry, now una supposed to dey do una genotype. Una supposed to don do una genotype a long time ago at the early stage of the relationship. Genotype no be test wey you supposed to dey do when you wan marry. Genotype na test do as you just dey start relationship so that in case una no dey compatible with una genotype, una go just know, not when una don dey close to marriage. You understand? Then the other test wey I go say make una do again, do your HIV screening, very important. Screen yourself for hepatitis, or what we dey call screen yourself for sexually transmitted diseases. That one day. Then you can do a blood sugar test, fasting blood sugar. Screen yourself, make una check una blood pressure. Then if you get any family problem, like una get any family sickness, e go good make una also test una self. You understand? Make them know whether this problem e dey for the family or not. These are some of the tests wey you go do if you dey plan to get married. And then some women go talk say, okay, make we do fertility screening. Fertility screening no be common test wey people dey do like that. You understand? But um fertility screening, some ladies dey do that test. Yes, welcome. Okay, the person wey ask me the question don come this session. I don't see you. I'm not going to call your name. But once again, let me use opportunity. I know you can hear me. I want to tell you thank you for joining my membership. So you asked me the question in my membership and I responded. But I just decided, let me answer the question here again. So in case you didn't hear my answer, let me say it again. I said genotype. Yeah, blood group. No, irrespective of your blood group, you can still get married. Irrespective of your blood group, you can still get married. Whether you are A positive, A negative, B positive, B negative, whatever your blood group is, you can still get married. You understand? Nobody talks say you no go marry because of your blood group. Waiting we dey really hammer on for compatibility na genotype. But blood group versus positivity and versus negativity, that one day special. So let me answer again. At the beginning of your relationship, now you supposed to test yourself for genotype. Not be when you won't marry. I think it is abnormal. Say a man and a woman, una don dey date 1 year, 2 year, 3 years. The time where una won't come marry, now una come dey go do genotype test. So what if you guys are not compatible? Now that time una won't come break. Doesn't make sense. You understand? So I feel now the early stage of the relationship, now una supposed to do genotype. Then you go do your what again? HIV screening, hepatitis, other sexually transmitted diseases screening. You go do your blood sugar test. You can check your kidneys, and then one very important test, mental screening. Some people look as if say they normal, but they are not normal. Hmm? Yeah, good evening. Welcome, welcome. I see you. Good evening. I'm live on YouTube. I'm live on Facebook. I'm live on TikTok. Hmm? Recently, Anthony is watching me on YouTube. Anthony say, recently, I find myself breathing heavily. What is the cause and solution to stop it? Anthony. Okay, I think this guy just to watch us for the first time. This platform here where you dey watch me, there is no way we go prescribe medicine for you here. There is no way we go treat you here. Do you understand? Now, the reason I'm saying this because there is an abnormality and there's an anomaly. There is a disorder, there is a disaster, there is a sickness on social media where people they find treatment on social media. Social media is not the place for treatment. Social media is the place for you to get information, to know things more. But for you to get treated, you have to go to the hospital. So if you dey breathe heavily, many things fit cause am. If it be your lifestyle, if it be say you get heart problem, if it be say you get lungs problem, if it be say you get problem with the blood, many things can cause that. So I can't confidently tell you why you are having heavy breathing on Facebook or YouTube. I can't make any diagnosis for you. I can't even prescribe anything for you. This is why we always beg people, say, please, if you get any medical sickness, medical condition, always go to the hospital and see your doctor. I know some people don't go like when I talk, but that is the best thing we can actually do for you. Is that okay? Yes, those on TikTok, how are you? So, Mr. Anthony, I can't tell you why you are breathing heavy. I can't tell you the solution. The best solution for you now for you to go hospital, make them check you. Is that okay? Yes, good evening, good evening. How are you? If you can hear me, you are welcome. Before I continue, I'm talking about I'm taking questions and answer here. You understand? So if you get questions, ask me. Very, very important again. The fruit challenge comes up on the 1st of February. Fruit challenge. The fruit challenge now a challenge where we don't they do for 2 years now. I don't they do them for 2 years on social media. This challenge will help you live healthy, will help you look fresh, your skin will look good, you will feel your immune system go they okay. You know go they fall sick. Yeah, the challenge be say you go they chop fruits together with your normal food every day for 1 month. Every day. You eat your normal food at the same time, you eat fruits every day. You go do them for 1 month. All the details, they my page. So I want you to start preparing so that you go join me as we start the fruit challenge on Facebook only. Dr. Fredostar official. On Facebook only. So start preparing yourself to join me. Good evening. So I have a question. Dr. Blessing, how far? Dr. Blessing, they watch me on TikTok. For somebody asking me this question on Facebook, I did cesarean section January 30th, 2023. That is about a year ago. I'm 5 months gone. Please, can I have a normal delivery? Your name na Arike Ade. Arike Ade, I think that you are asking the wrong question, and I'll tell you why. When you do CS, your doctor will tell you, say, after this CSO, you are supposed to wait for like a minimum of 2 years. Some will tell you 3 years. Wait so before you get belly again, so that your wound, that CS side go heal very well. Your body go recover very well. They will tell you, may you wait for at least 2 years. If you can't get belly within a space of 1 year, madam, your doctor will check you, will tell you, say, okay, you are fine. Nobody go beat you, nobody go shout for you. They will take care of you. But thinking of going for a vaginal delivery after giving birth in less than the normal time puts you at risk. You. So my advice to you now, follow your doctor, make them check you and everything. No go listen to people outside. You understand? It can be very, very bad. So please, the best advice is ensure that you take your medications, you go for your antenatal care. When it's time for delivery, your doctors will surely take care of you. So don't put yourself in danger by thinking of saying you want to push by yourself. You might end up rupturing your uterus. Dr. Chukuma Alpha, Dr. Chukuma is online. Dr. Chukuma, yes, VBAC is 2 years at least. And also, waiting be the reason we make them do CS for you. What was the indication for the first cesarean section? So many things they involved, and nobody go allow you push by yourself when you go give birth or get pregnant in less than 2 years. If you do that, you are putting your life at risk. Yes. Yeah. Welcome, welcome. If you know you are gaining value here, click on the like button. And then for anybody who wants to join my membership, look at the top of this live session. You will see the link there. You can subscribe and join my membership. Chukuma, how you day? Please, what is the effect on a 33 years old man who hasn't had sex all his life? Is there any medical side effects? I like this question. I like this question very, very well. Very well. You know why? Because I made a video few days ago about the benefits of Twetwe. And a lot of people loved it. Some people were angry about it. Some people were like, what if I never knock for my life before? What go do me? So I want you to understand something. There are a lot of people who no knock for their life and nothing do them. First of all, I get some medical doctors on TikTok. I get 2 medical doctors already on TikTok where they comment. I go read their comment for you. Don't worry. I'll read their comments. I'm giving you my own opinion. I think they have their own different opinion here. First of all, there are a lot of people who never did Twetwe in their life and nothing happened to them. We have men who were monks. We have those in seminaries. We have men and women like that. So nothing to them. Talking about knacking and the benefits, we no talk say make you go to carry your blockers, knack anybody if you are not ready to engage in that act. You understand? Now let me read what they said. The first medical doctor here says, I don't like that question. Okay, fine. The second medical doctor here says the man will be under social stress. Yes, I agree with this. Social stress because of our environment. By the time you listen to some things where people they talk, if it puts you under pressure, thinking that my life no they move forward, so you might have social pressure on you, social stress like, Oga, you never knock, you are not a man, this and this and this and this and this. So now your life, you understand, unless you won't do, but you know fit. That is a different ball altogether. But if you are not interested in having intercourse, it's your life. Nobody's going to force you for that. And then he now said the man can suffer depression. Well, it's possible. It's possible. At the same time, it might not still happen. Good evening, Elizabeth. Thank you very, very much. Yeah. Welcome. Hello, I see you. Please, doctor, is it good to take vitamin B and B6 together? Juliet, who they give you vitamin B and B6 together? There's what we call vitamin B complex. I have made a video about vitamin B. You understand? I made a video about vitamin B. The video is on YouTube and on Facebook. You watch that video. Yes, you can take vitamin B, but nobody will tell you, what do you mean by vitamin B and B6? There's B1, B2, B3, B4, B6, B7, B9, B12. There are different types of B vitamins. So if you want to go take one and leave the other one, unless na medical doctor now tell you say make you take vitamin B6 specifically, you understand? But generally, vitamin B, your food, your vegetables, they your fruits, they your nuts, they your grains. You can get vitamin B from even your avocado. Vitamin B they inside. But if you think you need more vitamins, then have a conversation with your doctor, make it check you, and then we'll tell you what to do. Hmm? Yeah, good evening. I have people watching me on YouTube. For those watching me on YouTube, how far? Yeah. Um, good evening, Agbesi. Some people have not subscribed. Don't forget, you can subscribe and join my private channel. I will respond to you. Hayat, hi, how you day? Okay. Somebody dropped a comment here. Make I read the comments. Somebody says no sound. It's from your end. Men who haven't had intercourse before they got married are always boring and they are not romantic at all. Is that true? Ladies and gentlemen, please, oh, women we don't marry, then say man we never do the do. When he marry, he dey always dey boring and they are not romantic at all. I can't defend this. No vex. I'm not a woman. I no fit defend them. Number two, I never hear people's experiences. Maybe this one are your experience. Maybe now your experience. One person. But unless we go sample opinion from so many women, we don't marry men, we no do the do before we can actually confirm. Somebody on TikTok is saying it's not true. Nah, she not there. It's not true. So, Floxy, somebody on TikTok says you are not right. No be every man we never do the do. When they marry, they boring. Some of them no they boring. Some of them they romantic. So I guess your opinion, it's different because a lady here don't tell you say a lie. Maybe she has experience in that area. Hmm? Okay. Yeah. It's not celebrity. How far? Hmm? Yes. The truth is this: not be everybody go do the do before they marry. A lot of people no go do the do before they marry, and their lives will be fine. You understand? So make we not make anybody feel pressured and feel like if I no knack before I marry, problem go do me. I like problem no go do you. You go fire down. Yes. So many people don't do it. Yeah. So if a man is not romantic, no be because he never do the do. Now in personality, you can learn to be romantic. Nobody need to sit you down as a man and tell you that call your baby, tell her and say I love you, I miss you, how are you? You're looking good. Look at your voice sounds so sweet. All those things make her they feel special. Very nice, very important. Do am. Not be say because you never knack before. That is why you are not romantic. That is why you are boring. Yeah, that is not an excuse at all. Yep. Okay, we have a question here. I really don't like this question. This particular question where this person asked me, I don't like them, but I know if you avoid them. So I'm gonna read the question here. The question says, what are the medical advantages and disadvantages of soapy? I don't want to mention the word. You know what I mean, right? What are the medical advantages and disadvantages of doing soapy in a man? Now, before I answer this question, number one, let me give a disclaimer. My page is not a church. This place not be religious house. I know they preach to you. You know, see pastor in front of my name. Waiting there in front of my name now, medical doctor. You understand? So I don't want any religious fanatics come the comment when we give you medical opinion. Number two, the last time I answered this question, somebody come they haunt me online, come they tag me, they comment rubbish. I can't block them. That was the first person I blocked on social media. So let me give you the answer. A lot of research has been done into soapy. A lot of research. A lot. One of the findings was that men where they engage in soapy, it they affect them mentally. addiction. It go make you addicted to that act. That is number one. Number two, it no go make you see value in woman. You no go see any reason to get a woman near you because you don't come. So why should you be with a woman if you can come on your own? So women no go look like anything for your eye. You hear me? So the next thing again, where they can't look, some people can't do more research and find out that apart from this, some men where they suffer from early or premature ejaculation, they might benefit from soapy. I'm using the word some men. I'm using the word they might benefit. Some might benefit from soapy. As a guy, I'm talking to you now, giving you my own opinion. As a guy, I no go encourage you to do soapy. I'm not judging you, neither am I castigating you. There are some things we find ourselves doing that we didn't know how we got into them. But as a guy man, yes, as a guy man, eh, I no go encourage you to do soapy. Furthermore, if you did do soapy, I would encourage you to please seek help. The earlier, the better. A lot of men when they do soapy no go like them. So why you go tell me make I stop soapy? Now your life, nobody go force you, but I'm just giving you my own opinion. Soapy go affect you later on. So I don't think you should engage in it. I'm not preaching to you. I'm just giving you my own opinion. You understand? It go affect you. See, it go mess up with you mentally. Like it will mess up with you. Yeah. Now I'm not saying I'm better than you because I know they do them, or because you they do soapy, you did very bad. No. Yeah. Because say they do soapy now means that you are an outcast. Never. Some people say if we know they do soapy, even worse past you. But in this area of your life, I think as a guy, you know good to make you they do them, it will affect you. So as a guy man, one-on-one, no runner. It's better to do the other one where God arrange, make it they do than soapy. Huh? If you know, you know, right? Good. You understand? Yeah, yep. Okay, I love the teaching. Thank you very much. Good life in that sense. Please, if you know you are gaining value, share the page, share. Watching from Cameroon. Knacking is the way, good one. Excess dopamine effect can slow you down, and dopamine is released when you do soapy. So Dr. Blessing on TikTok, when you do that soapy too much, you will give your brain overstimulation with dopamine every time, and you don't want to be having too much of dopamine release in your brain. Yeah, long time, Manuel. Do long time. I was here. First time watching you live. Roots Cherry, how are you? Thank you very much. How are you doing? Where are you watching from? Good evening. Good evening. We are live on Facebook. We are live on YouTube. We are live on TikTok. Yeah, good evening. Elizabeth, why are you laughing? I want to say this again. For all those my loyal fans, why haven't you subscribed to my Telegram channel? Why haven't you subscribed? Those who don't take they follow me, why you never subscribe? Yes, I see a lot of you asking me questions. I can't even respond because I'm very busy. So for the people who don't they follow me a long time, why you never subscribe now? No, why? Answer me. Okay. Let's answer this question here. Good evening from Jumbo. I usually experience constant headache. I have done a general medical test, and the doctor told me that it's malaria. But even after taking some malaria injections and medications, I still experience the headache. The constant headache is over 2 months now, so I really don't know what to do. Dr. Blessing, I beg, Mr. Jumbo, there is no way malaria will give you headache for 2 months. There is no way malaria will give you headache for 2 months. You understand? There is no way. I feel if you have taken anti-malaria medication and you are still having headache, then we need to check something else. We need to check your lifestyle. We need to check your sleeping pattern. We need to check sometimes in developed world, they might even need to do a CT scan for you. You get the point. So malaria, giving you constant headache for 2 months, it's a no. I don't think malaria will cause that for you, unless you are telling us that the headache go come, it go disappear. After it go come, it go disappear. If that is the case, then maybe malaria. But say now you just get headache continuously for 2 months, there are other things to consider. Check your lifestyle, check your work-life balance, your sleeping pattern. You understand what again? And then I don't even know what you mean by general medical test. What medical test did you do? Hmm? Did you do? Did you even do a CT scan? Because if you are having headache continuously for 2 months, bro, I feel that you should be checked. Mm, yep. Okay. Somebody says I'm your old fan. Okay, my old fan. You see, when I say subscribe, I don't mean the link is for everybody. Oh. Subscription means you will pay. I have people here that have subscribed. They paid to subscribe and they are watching me now. Hmm? They are watching me here. So I beg, the subscription link is not free. Now only special people we you understand. We be really loyal people and them. Okay, let's take one question here. I usually feel pain at the back of my neck, right down to my back. What can I do? I think, Jenny, I think you should see your doctor, make them check you. Because if you're having pain at the back of your neck, right down to your back, uh, general advice, you need to rest. Rest, take analgesic, and see if it will disappear. But if you don't rest, like you are not stressed, you have taken medication, and yet you are still having that pain, then it's important you see a doctor, make them check you and find out why you get pain from the back of your neck down, from your neck down to your lower spine. Lily's kitchen, come up for here. Lily's kitchen, live here. Lily's kitchen, live here. Yes, I am. Are you from Owan? No, not. I'm not west. Not west. Okay, we have a question here. Does not having sex contribute to prostate cancer? And how many times a month, averagely, is a man supposed to ejaculate? Hey God, I beg oh. Why is it that you people love sex so much? Oh God. Okay, let's answer your question again. Yes, people have done research. A lot of medical professionals did research. A lot of urologists under prostate cancer, they did some research and were like finding out why some men they get prostate cancer, why some others no they get. And among their findings, they now discovered that some men wey no get prostate cancer, they notice that these men them they ejaculate more. That is, that they release more. Some of these men wey no get prostate cancer, some of them that they ejaculate more, that they release. They also notice that some men too wey no dey ejaculate, these men no also get prostate cancer. Example, like the monks. You understand? Some men wey no marry for their life, wey no engage in intercourse. Some of them no get prostate cancer. Now, the reason I'm saying this is not for you to run with the narrative and say that if you want prevent prostate cancer, go the knack, the release. It's not conclusive. They are still carrying out more research on that. Do you understand? It is not conclusive. I have discussed about this on my page last year with a urologist. They also did the research on that. Dr. Martins Igbokwe is a consultant urologist. He's also a kidney transplant surgeon. I'm quoting him. I'm calling his name because he was on this page. You understand? And he also mentioned that. So you can go to YouTube or even this page. You will see his video there where we spoke about prostate cancer and knacking intercourse. Do you understand? Yep. Why are you people laughing? Una too like knacking. And when I made a video about knacking, Ngozi Alpha, Ngozi, I mean Alpha. What's up? How you day? You know what I mean, right? Alpha. When I made a video about knacking, I saw some hypocrites. Forgive me. I saw some hypocrites, and they were like, "Why would you be talking about knacking? Man, are you corrupting this generation?" And I was like, I don't get their time. You understand? I don't get their time. You know why I call them hypocrites? Because some of them, they knack anyhow. And because we come online and we did a video to educate people, they can't they attack us. But those people don't get mind to attack those other people. Yeah. I'm your newest fan. Get away. All of you calling yourself my new fan. What is the I will block you. Huh? I will come and meet you inside your dream. All of you this night. I will come and track you down. Lily's Kitchen, Jennifer. How will you be calling yourself my newest fan? See them. Subscribe. They agree. Okay, we have a question here. It says that I have serious cramp that no medication works for me. Every month I keep having monthly cramps. I don't know how else to manage it to at least ease the pain. Madam, so sorry that you did get severe menstrual cramps. I think the best advice for you now for you to go and see a gynecologist, because if you be woman and you dey on your period, you dey get pain, and nothing dey work for you. Please, you need to speak with a doctor, a gynecologist, make them find out why. That is the best advice I can give to you. I beg, make them check why you they get this kind of pain. I don't think you can get your answer on social media. You understand? Yeah. Okay. Just coming in. How far have you done that level? Ngozi Amina. Somebody's asking me, can you discuss hepatitis B and how to manage it? Hepatitis B. What do you want to know about hepatitis B? Okay, let me say this. There are different types of hepatitis: A, B, C, D, E. Apart from hepatitis B, other forms of hepatitis get cure. Some people we go chop you online, go tell you say they get the cure for hepatitis B, and then they will deceive you. They no go get cure for you. They go chop your money. You understand? So hepatitis B no get cure. Hepatitis B, you could get hepatitis B through sweatwear, through sharing of body fluid. You can get hepatitis B. How can it be managed? You manage hepatitis B through the use of antiviral agents. So when you get hepatitis B, they go check you, they go do tests for you, they go check your viral load, they go check your liver enzymes, they go find out if it affects you. If the viral load don't plenty for your body, they will give you antiviral agents to help you bring down the viral load. That is the number of virus. They will give you medicine to bring them down, and then other medicine to support your body. But if the viral load dey very small, they no go disturb you. They go just dey monitor you. But as at today, there is no permanent cure for hepatitis B. Then again, hepatitis B is more infective than HIV. So if person gets HIV and somebody gets hepatitis and you get intimate with the two of them, the likelihood of you getting infected with hepatitis B is higher than you getting infected with HIV. What that simply means is that hepatitis B, make I use pidgin, wetin e mean be say you go catch hepatitis B quicker, faster than HIV. Other factors dey involved: the level of your immune system, the level of contact wey you get with the person, the body fluid wey una share, the viral load for that person body. But hepatitis B virus is highly infective, much more than HIV. So if you dey watch me right now and you never go test yourself for hepatitis B, I would advise you to please go and do so. Get yourself tested. And if you are negative, go and get vaccinated. Receive the vaccine. I don't collect my own vaccine, 3 doses of the hepatitis B vaccine. So if you are negative, please go get the vaccine, and you are good to go. Somebody said, I have a question. Okay, ask your question. Ask your question. Ask your question. Um, oh boy, oh boy, oh boy. Okay. If you know you are getting, why una they laugh? People are laughing here. Waiting I talk where they make una laugh. Because I talk about Twetwe. Happy New Year, Rosie. Is it because I spoke about Twetwe? Knacking. You people love knacking so much. Okay. Good evening. Please, how many minutes is medical Twetwe meant to last in a man? And how many minutes does it take to satisfy a woman? Hey, God, I beg, oh. God, hey, voila. Hey, God. Okay. Okay. How many minutes knacking intercourse supposed to last? Um, First of all, this minute of knacking, it don't put a lot of people under pressure because now you and your partner, as long as you dey okay after you knack, you dey okay as a man, your partner as a woman, una two do knacking and una dey okay. There is no time limit for the two of you. But we go talk say average oh. Some people said now between 4 to 7 minutes. Average 4 to 7 minutes. Meaning that if you dey do 30 minutes, 1 hour, what are you looking for inside there? Why should you be doing 12 for 30 minutes and 1 hour? Why? This is the reason why a lot of young men are dying. You know why? Ladies, they put them on pressure. So they'll go, they drink things. You won't make your machine gun, make it stand for 1 hour. And you don't know, say, as that thing they stand for 1 hour, your heart, they work very fast. They pump blood, Small, they affect you. So you're not supposed to take anything to make that your rod, make it stand for too long. 4 to 7 minutes, 9 then talk. Sometimes it can get up to about 10 minutes for some men. Some guys can even get up to 15 minutes, but you won't want to stay there for 30 minutes, 1 hour, 2 hours. Why should you be wanting to the drill person picking? Na borehole, a borehole they there. I went to check on Tuesday, but my doctor said there is nothing wrong. So please, any advice for me? You went to check what? Your fan is greeting you from Sokoto. Benga Jerry, how are you? My scalp is always itching me and I don't know the cause. I went to check, but my doctor said there is nothing wrong. So please, any advice? Did they give you any medication? Your scalp they itch you. So if you are a woman, the best advice for you now, you might need to cut your hair first. You might need to cut your hair, and then depending on the findings, maybe you're going to need to use a certain shampoo to wash your hair to help you give your hair breeze to enter the hair. Maybe it will help you reduce the itching. But I believe that your doctor will give you medicine to help you. Tomorrow, Ngozi. Tomorrow. Okay, let's see how it goes. No problem. Why do you people like ejaculation today? Wetin I do una with ejaculation on my page today? How many times averagely in a month should a man ejaculate? Hey God, how many times? So a man, at least 3 times in a week, you're supposed to do twelve, abi, with your woman, with your wife, 3 times in a week. So 3 times in a week, 4 weeks in a month. So 3 times 4 is 12. So minimum, if you can, 12. 12 times, three times in a week, na then talk. Uh-huh. Especially for those wey wan get pikin. So at least 3 times in a week, minimum. So in a month, it will be like 12 times. So many questions. Ladies and gentlemen, he wants to be reborn. He wants to be reborn. You people are spoiled. You don't spoil. If you know you are gaining value here, share this live session. I beg everybody. Those on YouTube, share the live session. Can too much of pressing phone cause constant headache? Yeah, thank you for this question. You might need to go get your eyes checked too. Ladies, people on TikTok. Okay, let me answer a question on TikTok. Yes, you might also need to get your eyes checked. Because pressing of phone uh, can affect you, especially if you spend too much time. Especially if you spend too much time on your phone. Ladies and gentlemen, one fine girl just enter my TikTok. One very fine girl. 2022, I been like this babe, but she used me to shakara. She fell on another man, but she's on my live session right now. I just see her name. Very fine babe. Alpha, you don't marry Abby? Don't worry. You, you do me like this. I'm not gonna mention your name. Tell me the babe. I ain't gonna tell you the babe. This babe used me do like this. One fine girl. She do on TikTok, but I ain't gonna call her name. Tag her. I ain't calling her name because I know you people here. Before when I go, they talk another thing. Okay, let me read question here. I have a friend who see her period twice a month. Is that a medical condition? Um, no. Some women can actually see their period 2 times in a month, and it is normal. I see am. You people, una know well though. You people are not okay. Okay, so some women can see their period twice in a month, and they normal. Especially if you get 21 days menstrual cycle. 21 days menstrual cycle, 22 days, 23 days, 24 days. So if your menstrual cycle length day short, you can see your period twice in a month and you have no problem. Yeah. Okay, God though. My head don dey hot. My head won't blow. Make una send me star now. Una no dey send me star. I don't know what people are talking about on this TikTok. I don't know what you guys are talking about on TikTok. People on TikTok are commenting another thing. Eweleke, wetin happen? Floxy. What happened? Mary, I don't test and negative, but haven't taken the vaccine. Please try to get the vaccine. Your network is not networking. Oh, really? Is it my network? My network is good though. Good evening. Good evening. Doctor, can filariasis be caught through kissing? No, 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 no. Filariasis is not cannot the chances of getting filariasis through kissing, no, is not a mode of transmission. People don't spoil. Okay, oh my God, my head. I know a partner who has hepatitis B and the other don't have. What is the cause of that? And maybe the other partner now along the line, maybe something make them get hepatitis B. People can get hepatitis B, you understand, through many means. So if one partner gets and the other partner no gets, yes, maybe the other partner don't even go collect vaccine where we no know. You understand? This is why it go good if that partner still dey negative, make e go collect vaccine, basically. Or maybe the viral load for that partner we get am, dey very, very small. Hello, how are you? Your network is not networking. Beauty icon, Berlin. Judith, how are you? Judith, how you dey? Who again is here? I can't see your questions though. I have cut my hair, but the itching did not stop. Oh, did you take any medicine? Where do you live? After 10 is no longer enjoyable. Oh, after 10 minutes of knacking. Knacking is no longer enjoyable. Ladies, is that true? Then say after 10 minutes of twetwe, you don't like it again. Is that true? Yes or no? Today na today. Let's see. Because he want okay, Chibuz or fear girl na borehole. Now, borehole, how will you be sitting inside that place for 30 minutes? You haven't answered my question. I didn't see your question, beauty icon. Please send it again. Twetwe is powerful, oh. Oh my God, where did I get you people from? You people have spoiled. You people have spoiled. You people have spoiled. Look at this, madam. Beauty icon. I can't see it, I swear. Please, it's not coming up. Send it again. Good vibe only. Um, can cholesterol cause weak erection in men? Cholesterol is normal, it's good for your body. High cholesterol might not directly cause you weak erection. High cholesterol will not directly cause you problem with performance. I'm using the word directly because in medicine, you should be able to explain the process. It's called pathology, pathogenesis. So I'm sorry for this big grammar. I'm sorry. Forgive me. It's not my intention. What we simply mean is that when somebody get high cholesterol, how will high cholesterol affect the blood course? Let me give you one. When somebody get high cholesterol go dey deposit inside the arteries, your blood vessel go dey deposit inside small small, wetin go come cause wetin we dey call plaques, go come cause you atherosclerosis. When you come develop atherosclerosis, later on you fit develop high blood pressure. That atherosclerosis fit also affect you, fit block blood vessel wey dey supply your blood course. When you come get hypertension, if you no manage am, e fit affect your heart. And when you get heart problem, e fit affect your performance. So for you to say because you get high cholesterol, that is why you cannot perform, it's a long process, it's a long pathway, it's a long channel. I had ectopic pregnancy, October 22nd. I did surgery. Then I find it difficult to get pregnant again. What could be the cause? Beauty icon. So when you did ectopic pregnancy, did they remove that tube? If they remove that tube, the other tube wey dey there, they need to find out whether the tube dey open or be the tube dey blocked. If the tube dey open, there's a very high chance that you will get belle. So we need to find out if the other tube is patent, is open. If the tube is open, you are ovulating, then you should be pregnant. And furthermore, we also advise that you go with your partner so that maybe we check whether your partner too gets normal sperm count, sperm motility, and active sperm cells. But that other tube needs to be checked whether it dey open, patent. Yay! I don tire o. I don tire o. Doctor, which link dey take dey use send stars? I don't even want anybody to send me star. Instead of you sending me star, just subscribe and join my private channel. It's better that way because if you send me star, you just send star, you don't go. And sometimes people can send me stars of $5. But with $2, you can subscribe and join my private channel. It's better that way. So I want you, instead of sending me star, subscribe and join. Look up on the link of this video. You will see the subscribe. Subscribe and join. There you will see me more. You will interact more. You are not live on your official page. I am there. I'm live on my two Facebook page. What is your name on YouTube? Dr. Fredostar. Dr. Fredostar. Dr. Fredostar. That is the name, Dr. Fredostar. Doctor. You spell doctor in full, you put a space, you spell Fredostar. Go there, you will see me live now. And then when you go on YouTube, you can also send me super chats, super stickers. Everybody, make una subscribe to my YouTube channel, abeg. If you have not seen your menses for 4 years, What can you take to reverse it? I am 38 years old. 38 years old, you haven't seen your menses for 4 years. Madam, I understand that you are worried and you are concerned. Please, I beg you. 4 years is extremely long. Why did you have to wait for 4 years? I would beg you, you need to go to the hospital. On this page, let me say this again. On this page, I know they prescribe medicine on social media to treat anybody. I know they do them. No matter how much you cry or beg, I know they do them because it's against medical ethics. I know they prescribe medicines for you. So if you get any medical problem, please go to the hospital and see a doctor. Make it check you. Your condition is beyond social media. And don't take any medicine from anybody on social media because they might spoil your body for you and worsen your condition. The best thing for you to do is for you to go to the hospital, see a gynecologist. They will check you, carry out some tests on you. They will check your hormones definitely. They will check your ovaries definitely and some other stuffs. And then find out what is happening. And then if there is a need, prescribe medicines for you. But coming online and looking for medicine to drink, I'm drawing my ear with all humility. Don't try it to take medicine from anybody online. The person if he kill you and you no go know, so this person you don't even know anything. Okay, you don't get Dr. Ruben from Adamawa. Dr. Ruben, greetings, sir. Thank you very much. You don't get paid for the stars we sent. Yes, for people on TikTok, TikTok they chop una money. When you buy roses and you send to people online, TikTok takes 70% or even 80%. So if you want to appreciate anybody on TikTok or social media, look for the person account, send them rather than sending them stars because TikTok they make money from your head. Um, um, I have a question. Okay, please ask. I don't tire. My head don't hurt. My head they hurt. So yeah, so the please, please love and like and share. Please support it where some people love knacking. And whenever I'm talking about knacking, they're always happy. But please, I beg, if you know you are getting value from my page, please share, like, invite your friends. Thank you very much. Um, well done. Hey, Dr. Mido, long time. Sir, why head they betting? I no understand. Jesus Christ. See, my head they hurt. What is the fruit good for ulcer patients? Okay, I like this question. Somebody is asking me a question on TikTok. I'm on YouTube, Facebook, and TikTok. It says, what fruit is good for ulcer patients? Let me say this. We have some medical doctors watching right now. And in case I say anything wrong, let me know. Not everybody will get ulcer. Diagnosed ulcer, confirmed, not ulcer where you dey guess from your head. Ulcer where a medical doctor don't confirm. Not everybody will get ulcer go get problem with eating fruits. But we have noticed that some fruits will get vitamin C in them, citrus fruits can cause you problem, like your oranges, like your pineapple, like your watermelon. These fruits, if you get ulcer and you chop them, if it give you problem, if it give you heartburn. So wetin we dey always advise people wey get ulcer be say, number one, take note of any fruits wey dey give you problem. Because if I tell you not to eat oranges today and you get ulcer, you drink orange, you lick orange and e no give you problem, you understand? So take note of all those fruits wey get vitamin C, wey get citrus acid. Take note of them. If you take them, there's a high chance that they can give you heartburn. Oranges, tangerine, pineapple, watermelon. Which other one again? These fruits can actually give you heartburn. So take note of them. But if you know, say these fruits no, they give you heartburn. Okay, continue. It's your life. Please, can you educate me how to send stars and what do I need to have before sending stars on Facebook? Okay, number one, you can't send stars on Facebook if you are using Facebook Lights. You can't send stars on Facebook. So you have to use the normal Facebook app. Number two, for you to send stars to anybody on Facebook, you have to use your card details. Facebook will ask for your card details. You put in your card details, you get number of stars, and you send. I prefer that anybody who wants to send me star, instead of sending star, just subscribe. Look for the link. That money for star, use them subscribe. When you subscribe, me and you, we go interact more. So you are gaining more value. I don't just want people to send me stars and just go like that. I want you to send stars, subscribe, and then you can gain more value. Sure, you understand? Yeah. But if you're cool with sending stars, it's okay. I don't tire. I don't tire. Please, aside from morality, is masturbation in any way good for the body? Joshua, I have answered this question few minutes ago before you came. Thank you for the stars. Abe, thank you so much for the stars. I received your stars. God bless you. I received the stars. Um, we have answered this before. Masturbation, we don't answer them before. I don't tire, they get headache. See, oh God, I don't want to talk about masturbation. I know they like talk about this thing. Okay, let me answer again because some people know they when I talk about them. Number one, I'm saying this as a disclaimer. What I said before. Here is not a religious page. Here is not a church. Here is not no pastor day here. Na medical page, na doctor day here. So I'm not your pastor. I'm not your preacher. I'm a licensed medical doctor. So everything I'm telling you is from the medical perspective. You understand, right? Number two, I'm going to try as much as possible to give you the evidence a little. So masturbation can cause you addiction. It can affect you mentally. Masturbation can make you see no value in women. You no go like near woman because waiting woman won't do for you where you know if you do by yourself. No be to release. After you don't release, what else? So as a woman, what can you offer me when I don't release? You understand? So it will affect your relationship. Whether you are married or you are not married, it will affect you. You understand? And then a little, in quotes, a little benefit. Some men will get premature ejaculation. They told them that, okay, they can try that. But there are other ways to manage premature ejaculation other than doing soapy. So as a guy now, as a guy man, I would encourage you to try and stop. If they do soapy, I would encourage you to stop. I'm not coming here to preach to anybody, and I don't want anybody to do parts of my page. You get? But as a guy man, one-on-one, instead of doing soapy, if you want to do soapy, go and knock. Now, some people say that instead of meeting a woman that make me commit, be like I don't commit bad thing, make I use my hand do them. That way, you are messing with yourself mentally. That is just from me to you. Let me tell you about the fruit challenge as I prepare to round up. Let me tell you about the fruit challenge. The fruit challenge starts on the 1st of February 2024 to the last day of February 2024. The fruit challenge have been doing this for 2 years on social media. What it simply means is that every day throughout the month of February, you must eat fruits every day, in addition to your normal diet, in addition to whatever you are taking for your meal. Every day you should please eat fruits every day throughout the month of February. It's a challenge. I eat fruits almost every day. So I decided to introduce people online to this, and it's been wonderful. We're starting on the 1st of February to the last day of February. What do you need to do? Make sure you are following me on Facebook, Dr. Fredostar Official. Dr. Fredostar Official. Follow me. That is where we are going to have the challenge. Every day, I would make a post, snap your fruits, if you are going to eat pineapple today, snap your pineapple and drop in the comment section every day on my page. We are going to give out prizes. We gave out prize the last time. We gave out 113,000 naira. Two of the people that gave me money, that sponsored the challenge, they are watching me right now. Here. Two of them. But they told me not to mention their names. Two of them, they sent me money to give out as prizes for the fruit challenge. So we are going to give out prize again for the fruit challenge. How would you qualify to win the prize? What you need to do, you now have to record yourself eating your fruits. Make your video very creative. Make your video fun, creative. Record it. Go to your Facebook profile or your Facebook page. Upload the video there. Tag me. Please, you have to tag me so that we can find you. Because if you don't tag me, we can't find you. You must tag me every day for the whole of February. Upload the videos on your page, eating your fruits, and at the end of the challenge, you stand a chance of winning the prize. Somebody won the prize the last time. Let me see her. What is their name? Lily's Kitchen, where are you? Lily's Kitchen, where are you? Dr. Blessing, get a wife. Get a wife and be knacking. Masturbation will do you no good. Yes, Lily's Kitchen came second in the last fruit challenge. Lily's Kitchen came second in the last fruit challenge. Edokbayi Josephine came first. And I was happy that they joined. So this particular challenge, I want you to participate. You go benefit. You go gain. I'm not gaining anything. I'm not making money. I don't even have any brand sponsoring this challenge. So I wish I had a brand sponsoring the challenge. But if you know you want to sponsor the challenge, please, I beg. If you know you want to sponsor the challenge, Mofe, how are you? Mofe, I see you on TikTok. No vex, yo. Can you make smoothie? No. For the food challenge, please do not make smoothie. I beg you. Don't do smoothie. Please don't do smoothie for the fruit challenge. I beg, don't do smoothie. So if you want to sponsor the challenge, please send me an email here. This is the page you must follow, everybody. I need sponsors for the fruit challenge. I want to give out money. I want to give out prizes to people. I want people to live healthy, to eat fruits. A lot of parents are not teaching their kids how to eat fruits. And I want to do that with the little platform I have. So I beg, if you know, say you want to sponsor the challenge and support me, that is the email there. Please send an email. I will respond to that mail and will tell you how it will go. I really need your listening. I no get bad to they do sponsor challenge. I beg go. You understand? Niger doctors they suffer. So no go reason me say because I did online and this guy is online, he should be using his money. I not get to no shit dey my nyash o because I know people like you now. When I come dey say I not get man, I no go do pass myself. But what about fruit salad? Sure, it's welcome. You can do fruit salad, no problem. But please follow me on Facebook. Okay. I have to go now. Thank you, everybody. Doctors make money all over because they deceive yourself. They play. You don't know how Nigerian doctors are suffering. They deceive yourself. So I don't tell you if you are waiting for me. Sakpa day here, this year. Thank you so much. What again? I have to go now. I want to say thank you to everybody for joining. I want to appreciate every one of you watching me on TikTok. Thank you very much. Olasukomi, yeah, thank you so much. And good night, Mary. Elizabeth, is there Elizabeth here? I think I saw Elizabeth. Lily's Kitchen, Ngozi Amina. Thank you very much. And remember, like I always say, good life now waiting. Why are you guys laughing? Good life now waiting. New here. Oh, you're new here. I'm just leaving right now. Hopefully, I'll be back on Thursday or Friday. Thursday. I have a meeting on Thursday. I won't be online again on Thursday. Good life in that sense. Thank you, everybody. God bless you. Take care and bye-bye.